Hello, I'm Jeremy Fernandez, bringing you our weekly live stream where we answer your questions about the COVID-19 pandemic. This week, we're focusing on the Australian healthcare system, what the problems the crisis has exposed and what opportunities there now are for reform and investment. So feel free to leave your questions in the comments sections below and we'll get to as many of those questions as possible. Joining us is the Vice President of the AMA, the Australian Medical Association, Dr. Chris Zappala, and the health economist, Angela Jackson. Angela and Chris, welcome to both of you. Now, let's begin by what this pandemic, Angela, has told you about the state of the economy and its responsiveness to a pandemic.
Well, we know that the impact, obviously, is primarily a health crisis, but the impact on our economy has been significant. So we have seen a huge increase in unemployment. And while the official rate at the moment is around 6%, many are saying that the real rate's around 20%. So the economy hasn't fared well. But I think what the government has shown is that by putting in place things like JobKeeper and some stimulus payments, that we've kept people, I guess, relatively economically secure for this period. So that actually, as a whole system, we're actually pretty well able to adapt very quickly to these types of crises. That's a good thing. Going forward, obviously, it's a different story. You know, we have to get back to normal, and what that new normal looks like is potentially really, really scary for a lot of people listening in today. They've maybe lost their job for the first time, and where will that next job come from? And so it's really opening up the question about what the role is for government in that, about how we generate economic growth going forward. What's the nature of that work going to look like into the future? And they're sort of the questions I think the government's really got to grapple with over the next 6 to 12 months.
Angela, the cost of that flexibility and that agility has been taking on more national debt to service things like JobSeeker and JobKeeper. What has that done to our economy? Has that been a good thing or a bad thing? A lot of our viewers have been writing in saying, where is all this money coming from and what are we going to do to repay it?
Right. Look, the really important thing from an economist's point of view here is to remember that, yes, there is this cost to the budget and it is big, right? So it's around, you know, even the JobKeeper, even though it was 60 billion less than they thought, it's still around $70 billion. Is that the real cost is only the cost of raising that money, if you like, or the cost of the economy is the inefficiency that creates. And that's much smaller than that headline figure because that money, that $70 billion is going into people's pockets and they're spending it. And then it comes back to government again, if you like, and jobs are created. So it's not a loss in itself. So we can get worried about that headline figure about government debt, but we shouldn't really be that concerned about it. It's about our ability to pay it back over the longer term, which we will be able to do as the economy grows again. So the concern really doesn't need to be as great as it is.
Dr. Zappala, what has this pandemic told you about the state of the health system and how ready it is to respond to a pandemic?
I think we did really well, and that's across the country as a whole. So from border to border, at the Commonwealth level as well as at the state and territory level, I think can be pretty pleased with the degree of cooperation and planning that happened. There are always lessons that can be learned, and hopefully we will take those on board about, you know, for example, did we move at the right time? You know, did we get things set up quickly enough and so on? But on the whole, I think the system did really well. It created a lot of spare capacity, which was clearly needed, introduced physical distancing, border closures and those sorts of things, which have been hugely important for managing the spread of the virus. And as a result of all of that, we've come out of this with relatively few numbers. And although tragic, relatively few deaths. And you only have to look overseas to numerous headline places to see many, many worse experiences. And so I think we can be pretty thankful and pleased with how we've done. But of course, the fight's not over yet. As Angela just alluded to, there's a long tail to this thing. And we're going to be fighting the virus for a little while yet. And that's going to require ongoing changes into the future.
You say that there are lessons to be learnt, as there would be in every country. Do you have any idea of what those lessons might be here in Australia at this relatively early stage?
So I think lessons around preparedness for PPE, preparedness for testing, for example. We're probably caught a little unawares with the scale of the requirement of those things and where we were going to actually get those products from. I mean, if you can believe it, it seems like most of the world's supply of surgical masks come from Wuhan. And so I didn't know that before this pandemic happened, but clearly looking at our supply lines and making sure that we've got if possible, domestic supply or stockpiles of these things, but a readiness to quickly upscale for testing. We don't want to run out of testing kits and so on. Quickly upscaling those sorts of things so that we can respond to pandemics in the future. So I don't think we did those things badly, by the way, but if we look critically back and say, well, look, how can we do this better if we're ever faced with this sort of thing going forward, then I think they're the sorts of lessons that we can look at.
Dr. Zappala, Melissa watching on the Facebook channel has just picked up on the points that you're just making. They're relying so heavily on imported supplies for health professionals at a critical time. Do you see those supply chains becoming more domesticated, so critical supplies being manufactured and sent across borders here in Australia alone?
Well, if we have the capacity to do that, then I think we'd all like to buy Australian. That's definitely a good thing, and I presume that Angela would agree with that as well. Yeah. From an economic point of view. But just in terms of security of the supply lines, that would be, obviously quite useful. But it also comes down to stockpiles, those sorts of things, forward planning. Where do we have these stockpiles situated? They're not just for hospitals. Remember, we've got GP practices, for example, that are at the front line, and we had a bit of trouble getting supplies out to community general practice in the early phases. And so having a look at those supply chains is definitely something we can do. And if we can source more of that domestically within Australia, then obviously that's going to be an added level of security for us going forward.
Angela, obviously we'd all love to make Australian, buy Australian with everything. It's not as simple as it sounds, is it, when you're talking about global supply chains and contracts?
Oh, look, across the board, no, but I think particularly when there are critical supplies like PPE, clearly that was an issue. And in fact, I think whether we were lucky or not, it could have become a really, really big issue. And that fragmentation between the sort of GPs and the rest of the health system also sort of was evident quite early on. It didn't get overly tested because the cases didn't rise to the level or the speed at which we had feared. But when it comes to PPE, it will cost us more to make it domestically, but we saw what the cost is if you can't do that. And that is, you can't necessarily see everybody, and all your medical professionals can't see all the patients coming through in a safe way. And that's simply, that cost has to be factored in as well. And I think going forward, we will do that, and there will be domestic production of these things so that we have that supply should an event like this happen again.
Angela, there was a really interesting change to the way states and territories dealt with the federal government in the very early stages of this pandemic. They came together in this national cabinet, which is now replacing COAG altogether. But we are starting to see a few fractures taking place, particularly where borders are concerned. We have this question here about whether the pandemic is giving certain states and territories cause for concern about their funding arrangements going forward from here. How do you see that playing out?
Well, they've actually just signed a new agreement. So around hospitals, the state and federal governments have just signed their new 5-year hospital funding agreement, securing funding going forward. So there isn't a lot to be worried about there. There was some concern as well for the state hospital systems in particular. Even though with the pandemic, we thought there was going to be a lot of extra healthcare and healthcare use, that didn't eventuate. And so actually the funding of hospitals was sort of put in jeopardy, if you like. And the Commonwealth has guaranteed that funding. So the picture isn't looking that bad, especially for the public health system. On the private side, there are some inherent problems there in terms of private health insurance that were evident before the crisis that may be made worse by the economic downturn, so people dropping out of private health insurance. So that might mean some of those concerns about the viability of private healthcare sort of become more pressing, if you like, over the next 6 to 12 months.
Dr. Zappala, can you weigh in on that question about health insurance, private health insurance, and its place in this post-COVID world, and how affordable it might be, and what burden that might put on funding arrangements for the public health system?
Look, I agree completely with what Angela just said there. I think we need to recognise that the balanced system that we have between public and private is a strength of our system, not a weakness. And there's no way that legions of patients could shift over to the public system and everything work as before and it cope. So we need a robust and viable private system, and that means that people need to be taking out private health insurance. And as Angela alluded to, and as everyone probably knows, the rates of private health insurance were trickling down steadily before coronavirus. And now with increasing affordability concerns across the board, you can't imagine that that's going to get any better. So I would hope and indeed expect government to intervene in some way to support private health insurance, which they've already done, obviously, to date with the rebate and regulation around the lifetime rating, for example, discounts for young people. But there's scope to nuance those strategies and those policies to make them more effective for the circumstances of today. We can look at payout ratios, for example, from the health funds, which were a key part of the Affordable Care Act in America, which was quite helpful in terms of increasing coverage when it was introduced. So there are changes that we can make that aren't going to require a huge amount of money, which is clearly going to be in short supply over the next little bit. But that's okay, because if we look at the impact of, for example, the government-funded rebate on private health insurance, there was definitely an increase and it was very helpful. But if you then look at the impact of the lifetime rating and the penalty that comes if you don't get insurance before the age of 30 and so on, a much bigger jump in private health insurance rates as a result of that regulatory change, which obviously costs much less to the Commonwealth. So they're the sorts of things that we would definitely be keen to pursue and chat about with the government, and we are going to have to lock some of those in to support the system going forward.
Dr. Zappala, taking a broader view, a number of our viewers have been writing in with this question. Lincoln is one of them. He has a feeling that the health system has been very reactive instead of proactive on preventable diseases, even before this pandemic broke out. And that results in comorbidities that put people at higher risk. So do you agree with the proposition here put by Lincoln that more should be done to tackle preventable illness so we don't see those sorts of comorbidities arising in a situation such as this?
I agree to a degree, and the way you do that is you fund in a very strong general practice sector, because that's where the majority of chronic disease care, health prevention, risk factor modification, all that sort of thing is very important, and where that has to happen on a regular basis. We need to fund general practitioners properly so that they are not just caught up doing lots of paperwork or not having sufficient time when someone comes in with problem A, that they can say, you know what, while you're here, let's check your blood pressure and make sure we've done your cholesterol and so on as well. So we need to empower and fund general practice so that it can do that. And there are some reforms on the table to achieve that sort of thing. But I agree with Lincoln, and that is exactly the sort of key change which we would be keen to see the government underwrite. And I think that's one of the areas where we definitely should spend some money in the next year or two, even though funds are going to be a bit scarce.
I'd just add
Angela,
to that.
yeah,
I think one of the things what this has shown is that public health is vital. So actually one of the biggest improvements over the last 100 years to healthcare isn't medicine, isn't costly things, it's improvements in public health care. And this has been a public health crisis. Now, there are other issues across public health and prevention in Australia that aren't being tackled, and that includes obesity, alcohol abuse, drug abuse, pollution. And we could get some really big gains across our health system by tackling those things as a society. Now, that's things like sugar taxes, and I know people don't like taxes, but about actually pricing the cost of people consuming too much sugar. Minimum prices for alcohol, for example, have huge huge public health benefits, looking at the overall level of pollution, which again have huge public health benefits to everybody in our community. So I think it opens up the debate about what are the areas where public health, because if you stop people getting sick in the first place, then they don't use those health services and they don't put the pressure on the system. And that's what we did with COVID. We stopped people getting sick. We stopped people getting the virus. And so the pressure didn't come to the health system. And if we can learn those lessons and maybe tackle some of those bigger public health issues that we've sort of deemed too difficult in Australia, then, the health benefits could be massive.
Angela, you've raised some really big ticket items there that are very difficult to sell. And one thing this pandemic has shown us is how difficult it is from a health communication point of view to sell some of these ideas. How much traction do you think that would get with the general public? Because it's not just you saying it. Viewers right now who are watching have also pointed out these sort of environmental factors and these lifestyle factors that contribute to the severity of a pandemic such as this.
Well, I think it's the opportunities now, because I think people can recognise that their behaviour impacts other people around them and that other people's behaviour around them impacts them. And so we get this idea of we don't just live in a vacuum, that we live in a community and all of us benefit and from everybody else being healthy around us. So I think now is the time for these discussions about the things that impact our general health and the things that we could do to improve that general health. But they're hard. It is hard. You mentioned sugar tax and people get very scared and get very worried. You mentioned things like a minimum price on alcohol. You can get drunk in this country for $1. Standard drink is as little as 20 cents in some cases. And that's just not acceptable. And the health impacts and the society-wide impacts of those things are huge. And it's time that we started having those difficult conversations. Otherwise, we won't get the health gains that we could.
Dr. Zappala, speaking of health communication, a question from one of our viewers during the week through the ABC News website was, how can scientific bodies and governments make sure that the majority of the population are using all of the science-based research and not obscure YouTube documentaries or Facebook posts that give weight to conspiracy theories? So, in short, we're talking here about fake news and fake cures for viruses that we've seen floating around. We've all seen them. How do you, from a health communication point of view, keep the public safe and keep science at the front of this debate?
Well, asking questions like this, and I guess me answering them is part of it, but you're never going to stop people consuming all sorts of anecdotal reports out there and with, social media and so on. And obviously, anecdotal reports is not an evidence base upon which we ever base medicine if we can help it. And so we need to look at the evidence. And that's the reason that we have family GPs, is so that if you've got a question, you can go and ask them and say, hey, listen, I'm not sure about, whether I should, for example, get the flu vax this year or not. Could you please, advise me on this? And then they can look at your risk profile and so on and make a determination with you about that. I think the other way that we could do it from a regulatory point of view is look at what we fund. So at the moment, people, often get quite exercised about the costs associated with the PBS system. And remember, for a drug to be listed on the PBS, there's a very, very rigorous process, a large review of the evidence, and only when there's a significant level of comfortable positive evidence is a medication put onto the PBS. By contrast, the complementary therapies and non-PBS medications that are sold in the billions, which by far and away represent the largest out-of-pocket cost to patients in the healthcare system, are unregulated.
Sorry to interrupt, but can you give us an example of what you're talking about and how we make that difference?
Yeah, sure. So, most of the for example, the supplements and the horseradish and the horny goat weed and whatever else that people are thinking might work. And just because someone comes along and says, hey, listen, I've taken this and it worked for me, frankly, doesn't mean anything. And so if, for example, we're going to provide a rebate for something, if we're going to fund it in some way, then there needs to be an adequate evidence base. If private health insurance, for example, is going to fund it, then there needs to be an adequate evidence base. Take, for example, hypnosis for smoking cessation. Doesn't work. There's been lots of trials done in it, meta-analyses, systematic reviews. So all the trials put together and it doesn't work. Would I stop someone from accessing it if they really wanted to? No, they can do that if they so choose, but should the system fund it? No. And I think that's the difference. So yes, we need to make sure people have credible information, and the GP is always going to be the most accessible source for that in terms of community medicine. But on another level, looking at what we fund, for example, and what we sell to people, how we allow it to be sold, for example, is another way that we could control those sorts of misinformations and miscommunications that seem to gather steam.
Dr. Zappala, sorry, Angela, go ahead.
I was just going to say, I think there is also a role for social media and for Facebook. So I know a lot of my friends who, for example, got cancer diagnoses. So Facebook knows this, and suddenly they get alternative medicine, popping up on their Facebook feed, things that wouldn't work, alternatives to chemotherapy, and dangerous sort of alternative treatments, if you like, in that scenario. So if Facebook's smart enough to sell the ad to those people, it's smart enough to stop it. So I think there is also a role for social media and the regulation of social media and the information that they are allowed to present to people in this scenario.
Okay, I've got a question for both of you. I'll start with you, Dr. Zappala, about an immediate concern this weekend. A lot of viewers have written into us about. It's about these protests, the Black Lives Matter protests that are planned for across the country this weekend. A lot of people wondering whether they should take part, because that would obviously demolish any sense of social distancing when you're gathered in large numbers like that. Premiers from around the states, in New South Wales, they've got an injunction before the Supreme Court. In South Australia, each state government, they're sort of allowing things to different degrees. Obviously, this is an issue that means a lot to different people, and people feel very strongly about it. Dr. Zappala, what should people consider before they decide whether to take part in one of these protests?
Wow, I mean that's a really difficult one, isn't it? I mean it's a very important issue, an important question, and I'm sure most people feel it's relevant and important to them on many levels. From a health point of view, and so just answering it from that perspective, we've gone to such great lengths to avoid groups of people congregating together and to reduce the opportunity for this virus, which is a slippery character still, from being able to spread from person to person. And while we may only have a very small number of known cases in the country at the moment, it doesn't mean, unfortunately, that there can't be inadvertent spread through the relative close contact, which I would imagine has to happen when you're gathering in large groups like that. The touching, the lack of personal, hand hygiene, for example, needs to be done regularly. The cough and sneeze etiquette, the 1.5 metre distancing is going to go completely out the window. And so without in any way diminishing the importance of the cause, I think we just need to implore people to recognise the huge effort that they've put in to date to keep themselves and their communities well, and to continue in that vein. And if they can find a safe way to voice their opinions, then of course that's fine. But to please recognise those health needs and not throw those out while we're trying to make a point in this way.
Angela, can I get you to answer that question as well? I mean, this is obviously a very difficult choice for a lot of people at this very critical juncture of this pandemic.
Look, it is, and I think it's important from a safety perspective that people understand their individual risk as well as the community risk. So to take the leadership from their government. So I think some governments, for example, in South Australia have said, look, yes, it can go ahead, that's fine, because the risk to the community is quite small, but still within that, individuals have a risk. And I think in some states where perhaps the community risk is greater, for example, still in Victoria, heed the advice in terms of trying to adhere to social distancing as much as possible, possibly wearing a mask, and just also being very aware of your individual risk in this sort of event. It is a really difficult one, because I think, the right to protest is one of our basic rights, and this is an incredibly important issue at an incredibly important time. And so I understand that people want their voices to be heard, but at the same time, we are coming just to the end of a pandemic in this country, and the risk is still there. And we don't, as Chris said, want to undo all the good work we've done.
Dr. Zappala, a number of people have written into us with questions about mental health. Very interesting that a couple of people wrote in specifically about having been in lockdown for this period of time, now suddenly feeling that they've got this sort of sense of disgust when they go out because they've become so accustomed to being isolated. As a doctor, do you have a view on how people should treat that reintegration back into society and back into whatever normal constitutes from a mental health perspective?
Goodness me, I mean, that's a really interesting question. I mean, when we contemplate the mental health impacts of the coronavirus pandemic and the isolation, I mean, one's thoughts naturally go to the financial stressors, the relationship stressors, the psychosocial stressors, and then obviously the confinement and the cabin fever, to use a colloquialism, that go with that. The reintegration is a really interesting concept. And just reflecting on that question, I do know some patients and even some people very close to me that are having trouble with that are disproportionately afraid still of the risk to themselves because they might have a health problem of some description, for example. And my only advice is that to be supported by family and friends. So if you want to go out and do some shopping, then do it in small bursts. Do it with people that you have confidence in. Do it in a staged way that you feel comfortable. And if needed, seek advice from your general practitioner. If, however, your degree of introversion and lack of motivation to do things looks like, from others' point of view, perhaps that it's crossing a line to being something that's not quite normal anymore, then that's when I think you should be having a chat with a doc or a psychologist and saying, listen, maybe I've not coping so well with this, and I need some new coping strategies to manage my pathway out of this. So there's a whole bunch of variables there, but social networks, so support networks, clearly very important, and general practitioners and psychologists if needed, and a slow integration and return to normal. So for example, just to take the work example, you don't have to go from complete home work from home work to completely going back to work all in one go. You can do it in a staged way and ease yourself back into it. That's my off-the-cuff suggestion.
Angela, I wonder if you can shed some light on how people tackle that, as this viewer puts it, close proximity phobia, being repulsed, withdrawn, afraid of resuming social relationships, because that has a very real impact on the economy in terms of how people go to the shops, go to the restaurants and go to gyms. What impact does that have on the economy?
Well, I think it's one of the things that, I know there was a lot of debate at the start of this pandemic about the health versus the economic costs. And one of the things I think some of those debates didn't take into account was that, in the middle of a pandemic, people don't want to go out. People have a natural fear of, interacting with others, of going shopping, of doing those things. The fact that people still have those fears, even though the risks are much smaller, is quite natural and it's quite normal. We all have different attitudes towards risks, and we're all going to adjust to this very differently over time. So I think, as Chris said, it's about taking it slowly. It's about getting out there when you can, and it's about seeking help, whether that's from a doctor or even say someone like Beyond Blue, I know has some amazing resources around COVID-19. Just sort of reach out and seek that help. We've all struggled with this at one point or the other. This has been a huge trauma, I guess, a collective trauma from, the initial fear about the pandemic to the lockdown itself, to that isolation, and now to re-emergence. And in the long term, obviously, the economic impacts are also going to impact on people's mental health. So just be aware that these things do impact us. There are a lot of resources and there's a lot of help out there. Get it, basically. Ask for that help, and there's no shame in that, and there's nothing to be, afraid of for asking for that help. It will help you readjust to this new world after, COVID-19 that we're all struggling with and we're all trying to.
Angela, Maureen O'Callaghan writes in asking about whether you think there is a high risk of a second wave of COVID-19, and how well do you think the health system would cope?
So we have a very good track and trace system in Australia. I mean, that's clear. We actually had it yesterday. My son had to get tested. Apparently he had a sore throat, although I'm dubious, he just didn't want to get out of school. So we had to go and get tested, and the testing was quick and it's efficient, and the tracing is up and running. So I think in the Australian context, the chance of a big second wave, there might be some small humps and smaller outbreaks, is probably quite small. We all have a role in that though. So any symptoms or any inclination that you might be sick, go and get tested, because as long as we can pick up on these cases quickly and get on top of any outbreaks, then I think we can probably, over the next 12 to 18 months until there's a vaccine, avoid any sort of major outbreak.
Dr. Zappala?
Look, I agree. There is, unfortunately, I guess, a small risk of a large outbreak, and we need to be prepared, I guess, mentally for the fact that there might need to be a slight tightening of restrictions again in the future, depending how numbers go. But hopefully what will happen is, as Angela says, that we'll have little outbreaks or cases crop up, and they'll be quickly identified by lots of testing and then really swift contact tracing, so that all the people and the associated individuals get the support and care that they need. And that's clearly going to be hopefully our mainstay of strategy going forward, and should be very effective. But it's always going to be still combined with the physical distancing, the cough and sneeze etiquette, the regular hand washing, and all those personal behaviours, because that is the thing that's going to most stop this virus, as Angela again says, until we probably get a vaccine at some point down the track.
Dr. Zappala, Jonathan O'Brien has this question about whether you expect any major changes to the way doctors and patients interact during diagnosis. And one of the things we've seen come very much to the fore during this period has been telehealth. How well is that working when doctor and patient can't actually be in the same room at the same time?
Well, mixed success, to be honest. The Australian Medical Association has been asking for telehealth to be added to the armamentarium of consultation options available for all healthcare professionals, but obviously doctors, for a long time now. And the coronavirus, and this is one good thing that came out of the coronavirus, sped that all up so that we now have that available. I think we should very much regard it as an addendum to normal face-to-face healthcare. There is no substitute for eyeballing someone in the same room, reading all of the non-verbals, being able to examine them, obviously, and have a proper interaction between doctor and patient. And that should never be replaced, and we should never allow that to be replaced. However, if you already know your doctor, for example, and you're just following up the results of tests, or you're just checking that some symptoms have resolved, then that's, I imagine, a quick consultation that would lend itself to telehealth. So as an addendum, it is definitely very helpful, and we would like to see it stay as part of practice. But it will need a little bit of definition around how it's going to best be used. And that's, of course, a little bit different from the way it was used in coronavirus, when we were trying to avoid people moving about and coming to hospital at all. That's not going to be the intent of telehealth going forward. It's going to be, as I say, an add-on to make contact with healthcare people, not just doctors, with say allied health, for example, easier. And to give you an allied health example, we do pulmonary or lung rehab in respiratory patients, which is an exercise course run over 8 weeks, and that always was done as a small class. And now we're actually running them via telehealth, and the patients love it. And that's a subgroup of people that, because they work, say, might not have been able to access that resource previously. So that's the sort of thing that might now be possible going forward.
Angela, I'm interested in your view of how telehealth has been working, particularly when you get people writing in like this. And there's a lot of anecdotal stories of people who say, such as this lady, who says she's foregone her mammogram due to the mobile units not being in service. That's clearly not a good thing.
There's probably two separate things. I think telehealth itself is, and the greater use of it is a huge improvement for healthcare more broadly. It increases accessibility, especially people in rural and regional Australia have much better accessibility to specialists, for example. And it also is a much more efficient system, for the patient at home. You can just call straight in. You don't have to go to the doctor's surgery and wait and all those sort of things. So it can be I think it's a fantastic sort of advancement, if you like, in healthcare. And I hope that the government, even with greater restrictions or however it wants to proceed, keeps it, in some sort of significant form. The second is around the deferral of certain healthcare during this crisis. And that's probably been one of the biggest concerns that I've certainly had. Now that's around breast screening, for example, that there's been delays in that have had to occur. occur. But across the board for cancer diagnosis, there's been a lot lower diagnosis of cancer over this period, which is a concern because obviously cancer isn't something that stops because of a pandemic. There have been lower rates of stroke, again, something that doesn't stop just because of pandemic. And we've seen lower presentations of sort of heart attacks at hospitals as well. Now, that's a concern because it means people haven't been going to hospital as they would have previously to seek medical care. And what I would say again to viewers today is let the doctor be the best judge about whether you need healthcare or not. If you're concerned at all, whether it's your GP or your hospital, they are safe places. PPE is widely available now. They will make sure that they are safe and that you are safe, but do not defer care because you think, oh, I'll just let it go. That isn't a safe option. You aren't the best person to judge that. A doctor is.
Dr. Zappala, how severe is that deferral of care?
Well, I guess the honest answer to that is we don't know yet. We know the average numbers of those conditions that Angela was mentioning, but just about everything has been diagnosed to a lesser degree over the last couple of months. And we know the average rate, for example, that we would diagnose, say in my area, say lung cancers every week, and we're not seeing them. And we know that they're still out there. We know that someone might not have presented with chest pain that in fact was a mild heart attack, and they can get over that and go on and perhaps dismiss it. But they've missed out on the risk factor modification and the other care that gets wrapped around those acute presentations. So we are very worried about that. And all I can do is reiterate what Angela said, and that is if you have unexplained symptoms, if you have risk factors, if you had an occurrence that seems unusual to you, for example, an episode of chest pain and now you're a bit more breathless than you usually were, then for goodness sake, please go to see your doctor. And it's not just breast screen, obviously, the endoscopy, all other sorts of screening was in hiatus as well. And so we need to just crack on with all of the screening and assessments that we used to normally do. And absolutely, the doctor and hospital is a safe place to go. All the appropriate precautions are in place.
Angela, a number of people have written in asking us about how they take time off during this period for sickness. If they've got a child who needs to be tested and therefore they have to quarantine, that comes out of sick leave. Other people who say if they have to isolate because they've been travelling, isolating for 14 days, does that come under sick leave or will it be covered by another yet to be established scheme, Karen asks. It doesn't seem very clear right now, does it?
No, and it's probably, if I was going to say what's one of the only major failings I think the government has had from the beginning and probably now is around this leave issue and making it really clear to people and making it easy for people to access. We don't want people going to work if they think they might have coronavirus or if they have any symptoms. I mean, that's really clear. So if you are in Australia, we obviously have a system where you can be a permanent employee or a casual employee. If you're considered a permanent employee, then you have sick leave, which you can access, and there should be additional carers leave as well for the coronavirus itself. If you're a casual and then you may not have that leave. Now, you need to check that because some casuals will have access to sick leave, and I suggest checking with Fair Work whether you qualify for sick leave or not. And that is one of the glaring, obviously, holes in the system at the moment is some of our lowest paid workers are not covered by sick leave if they get the coronavirus or if they have symptoms, and that means they're more likely to go to work when sick and therefore spread the illness. And I think there's still a role, even in this sort of, I guess, containment phase of the coronavirus over the next 18 months for that leave to be implemented by the government so that people aren't financially worse off for doing the right thing, I guess, for the community.
All right, before we wrap up, Dr. Zappala, I want to get your forecast of the medium to long term about how health policy is going to be shaped by this pandemic and what the best opportunities now are in front of us.
Well, I think telehealth we've already touched on is definitely one of them. We're going to have to see progress made in the private health area, as we've mentioned as well. And I think we are going to have to see investment in high quality general practice going forward as well. I think those three are definite. Even though we've just signed a public hospital agreement, that agreement had been in the wings for some time, and there is still shall I say, more to be done in the public hospital space that recognises the critical role that they have, not just in medical care service delivery, but in training, research and other activities like that. And coronavirus has shown exactly the sorts of extra things that public hospitals have to do and an extra burden that they have to take on. And we need to recognise that in the funding system and make it simplified if we can. So I think those top three things are a given, and public hospitals is on the wish list as well.
Angela, I'll get your view on that. One viewer I'll just mention has written in suggesting that the defence budget should be cut in favour of funding hospitals, medical research, firefighting, climate change, transport, education, all that sort of thing. It's kind of an amusing question, but it's also a serious one because this is the very burden and the very difficult choices that the government's going to have to make in recovering from this pandemic, isn't it?
It is indeed. So I think what this pandemic has shown is that the health system is vital to our economy. So the two are interlinked. And what I hope to see going forward is a real appreciation of that, and that to see healthcare not as a cost, but as an investment. And if we can get that mindset right, then I think we can overcome a lot of the problems that Chris has alluded to around fragmentation across our health system, around the equity of access issues across our health system, and really drive what is an excellent system that serves us very well to the next level. And so Australians can really enjoy, I think, the healthcare system we all deserve. And I hope that's what comes out of this, that rather than seeing health as a cost, we see it as an investment and something that's critical, not just to society, but to the economy.
Angela Jackson, Chris Zappala, it's been terrific to have you both on the program. Thank you very much for joining us.
Thanks.
Thank you.
And thank you to our viewers as well who've been sending in questions right throughout the course of the last few weeks. We'll keep doing these live streams to get to your questions about how this coronavirus pandemic is playing out. So please write into us via the ABC News website and also stay in touch via YouTube and Facebook as well. Thank you for your company this afternoon. We'll see you again soon.